Welcome to NAHUC's virtual library. NAHUC is a professional association for health unit coordinators and other frontline healthcare professionals performing similar tasks. NAHUC is the provider of professional development for healthcare support team members. NAHUC is pleased to offer the webinar Stroke as presented by Dr. Christian Batchelor, neurologist and medical director of stroke care at Memorial Healthcare System in Florida. We are grateful to Dr. Batchelor for providing this content. This presentation first debuted at NAHUC's Education Conference in June of 2021. Information about earning contact hours through NAHUC's virtual library can be found at the end of this presentation and on the NAHUC website at www.nahuc.org.
All right, thank you everyone. Welcome, and it is my privilege to introduce Dr. Batchelor, who is our director of our stroke program at both Miramar and Pembroke, and he'll be telling a little bit more about himself, but we're really excited for you guys to learn a little more information about Memorial Neuroscience Institute and on stroke education. I'm first going to go ahead and play a video for you guys to hear.
My name is Jenny. I'm 51 years old and I had a stroke. I came home from a long shift. I'm a registered nurse. Went to bed around 10 o'clock in the morning. And I don't usually sleep for very long. My daughter came in the room around 6 p.m. She noticed that I wasn't acting right.
My daughter called up and said, "Dad, there's something wrong with Mom." I told my daughter Olivia, put her on speakerphone. She sounded she was impaired in some way. And I said, "Don't play any games with this, call 911.
Timing is everything. From the time the EMT noticed what it was, they called Memorial. They knew where to take me. The hospital was already waiting for me.
They rushed me into the room. I looked at her. She wasn't moving. I gave her a kiss. I told her I loved her. And her eyes were following me. They told me the procedure would be somewhere around an hour.
I am okay because they just removed the clot.
48 hours after the procedure, she was in the car on the way home.
I'm walking, I'm talking. I can still go to my job. Yeah, it's a miracle.
All right, we'll go ahead and have Dr. Batchelor share his presentation.
I'm Christian Batchelor, and I'm a vascular neurologist and a neurohospitalist at Memorial. I'm part of our wonderful stroke team that we've developed over the years here at Memorial. The other term for a vascular neurologist is a stroke neurologist. And what that is, we're inpatient specialized neurologists, and we've done extra training in the management of strokes specifically. And we have, 3 stroke neurologists here as part of the team, 4 actually. And Memorial's stroke program has expanded. It's one of the leading stroke programs in South Florida. And, I've done a lot of my training at very big academic university systems that had very strong stroke programs. And I can, honestly say that our stroke program is, right up there with any of those best hospitals in the country. So I'm really proud of that, and proud to be part of this wonderful organization. So with that being said, I'm going to jump right into the lecture, and then I can answer, well, I guess this is being recorded. I'll answer questions the next presentation. Okay, so the lecture is just going to be an introduction to stroke and what we call cerebrovascular disease, which is, kind of another term, an umbrella term for stroke. So to start off, let's talk about the main organ that we're dealing with here, and that's the brain, the most important organ in the body. And it's also one of the largest, but also one of the most complex organs in the body. It's one of the last frontiers of medicine, I like to say, that we, still don't completely understand. And it's so complex that I don't know if humans will ever completely understand the brain. There's more than 100 billion nerves. And, that's one of the reasons why it will be difficult to ever fully understand. And all those parts, all of those wires, essentially, they have to all work together to, keep you functioning properly. And when, the brain has a problem and part of it is, being damaged, that's what we call a stroke. And this is just a general image of what one type of stroke looks like. And another way that I like to explain it is similar to a heart attack, because a lot more people know what a heart attack is than a stroke. They know that a heart attack is one of your arteries in your heart is blocked, and that's causing you to have that pressure and for that heart muscle to die. And in a matter of speaking, a stroke is a brain attack. It's a very, very similar process that's going on. And it can happen to anyone at any time. And basically, the main type of stroke occurs when the blood flow to the brain is cut off. And you can see that in this picture here. And when that happens, brain cells are deprived of oxygen and they begin to die. And then when brain cells die during a stroke, that's what causes symptoms. That and when they start to suffocate, essentially. So when they're damaged and then when they die. And abilities of that that are controlled by that area of the brain. It could be many different things: language, vision, control of your muscles. So when that area is being damaged, then that corresponding ability is lost or impaired. And what causes a stroke? There's multiple things that cause a stroke. One of the main things that happens is what we call atherosclerotic disease of the blood vessels. And in this picture, you can see number one, a normal clean pipe. And these are the blood cells going through that deliver the oxygen. And, over time, you have this plaque buildup. So, a lot of people hear about plaque and plaque buildup and relating to heart problems and the heart attacks, but it's that whole similar process. It doesn't just happen in the arteries of the heart. There's arteries all over the body. And when it happens in the brain, then it causes strokes. It can actually happen not just in the brain and the heart, but in other places. And that's called, peripheral arterial disease. Some people might have heard of that or had a family member with that. And a lot of times when people have heart issues and then they know they have plaques in their heart, there's, a decent chance that, you're not going to just have plaques in that one spot. You might have plaques in the brain or in other areas too. So, this can happen in any size arteries, the smallest to the largest as well. And and the neck, the brain, so that the general term for all this plaque in the brain, that's what I was mentioning earlier. It's called cerebrovascular disease. Similar to cardiovascular disease is how they call it in the heart world. There's other terms people might see, in the internet or from any literature or in reports of tests, and those are atherosclerotic disease, small vessel disease, microangiopathy, all big, complex kind of sounding terms, but they all mean the same thing. It all means this process. And the other big silent killer, I call it, what causes a stroke, is something called atrial fibrillation. And some people, if they don't go by that term, know it as an irregular heartbeat. So this is a little different in that it's not a problem with those arteries themselves, with the plaques in those arteries. This is a problem of a blood clot forming in the heart, and then it travels up and then gets stuck in one of the arteries and then causes usually a big stroke. And this condition, it causes your heart to not beat regularly. It beats, you can see on this EKG, you don't have to read EKGs, but you can see that it's, these spikes as the heart beating, it's not in a regular pattern. It's kind of all over the place. And when that happens, the blood in the heart doesn't move like it normally does. It doesn't move as it should in a regular pattern. And what happens is that causes the blood to form blood clots. It causes it to get thicker. Whenever blood is doing something that it's not flowing like it normally does, it has a higher chance of forming a blood clot. So that's the big problem with atrial fibrillation. And as I said, it can be caused, it's known as a irregular heartbeat. The other thing about strokes, they're very variable in severity. It can be a small stroke with just minor symptoms. It could be a large stroke with major symptoms. You could be completely paralyzed. You can lose your speech, or you might just have a little bit of weakness in your wrist or your hand, or you might have a little bit of numbness, and that's it. The other interesting thing about strokes is you can just have a small stroke, a small part of your brain, but it's also the location that matters. If it's in a very important part of the brain that controls an important process, or there's a lot of wires in one little area, a small stroke can also be very devastating. And in terms of recovery, there is recovery from strokes. There is therapy, there's rehab centers, there's physical therapists, occupational therapists, speech therapists, and we employ all those here at Memorial. And some people completely recover, but a lot have some leftover symptoms. And unfortunately, there's always those group of people who don't recover at all. And some more statistics of stroke. Over 800,000 people in the US each year have a new or a second or third stroke. It's the 5th leading cause of death in the United States. And every 4 minutes, someone in the country dies from a stroke. In 2018, it was accountable for one of every 19 deaths in the United States. And there's about 55,000 more women that have a stroke each year. And it's a small percentage more than men, but women are at a higher risk of having a stroke. And up to 80% of strokes can be prevented. So stroke prevention is a big thing, and we'll talk about that soon. And it's the leading cause of disability in adults in the United States. And so by race, another risk factor. So African-American people have a higher risk of stroke than white people. And Black people have the highest rate of death due to stroke. And, there's could be some genetic component. We don't exactly know why that is. And it's not just African-Americans, it's all over the world. And the death rates have also shown to be a little bit higher in Hispanics as well. And stroke risk increases with age, but it can occur at any age. And in 2009, 34% of people hospitalized in strokes were less than 65 years old. So a third of people. So 1 in 7 strokes occurs in people aged 15 to 49. So there's 2 main types of strokes. There's the one that we talked about earlier with the blood flow being cut off, and that's called the ischemic stroke. So 87% of ischemic strokes are, 87% of all strokes are ischemic. And so basically the blood clot itself or the plaque itself closes off the blood vessel and stops blood from flowing. And then, downstream from that, the area supplied by that artery cannot get oxygen from the blood because of the blood cells that carry the oxygen, they can't get past that clot. And then if they don't have oxygen, then that area of the brain dies. The other type of stroke is called a hemorrhagic stroke. So this type of stroke accounts for 13%, And this happens when a blood vessel is weakened and it bursts, or it can be from an aneurysm. It could be, very high blood pressure makes you at a higher risk of this happening. And blood essentially spills into the brain, causing damage. And it's the, least common of the two, but it's also more deadly than the other type. The other type of stroke is referred to as a mini stroke, in the community, and you'll hear people say that. But the real term for that, what it means is a transient ischemic attack, or a TIA. And the term mini stroke is actually an incorrect term, in the sense that it's not an actual stroke. It was an almost stroke, I like to call it. So, it was a stroke that it's a event that was almost an ischemic stroke. There was almost damage done. There was permanent damage done, but it resolved. So that blood vessel opened back up, or another blood vessel took over for that blood vessel and was able to supply the blood and the oxygen. So the symptoms can be the same as a stroke, because you have the symptoms when the stroke is almost happening. That area of the brain is suffocating, but then it doesn't cause permanent brain damage because it opens back up. And those symptoms can come, they can go. It should never be ignored. It's a serious warning that there's something wrong, and that you might have a stroke in the near future. The other term that some people say is a heat stroke, but this is a completely different process. So this is not an actual stroke. This is just a term that's used for all the medical consequences and the physiological, the body's consequences of overheating and being out in the sun and having your temperature of your body get too high. So you can have confusion, sweating, nausea. You'll start breathing fast, rapid heart rate, but it's not related to this overall umbrella of cerebrovascular disease. Not related to the other types of strokes that we're discussing here. So, importantly, how do you recognize a stroke? What are the signs and symptoms? So there's, common things that you can see, and there's, uncommon things that you can see. It's important to know what it looks like, so that you can, know if, you have a friend or family member experiencing something like that, you can act quickly. And, you have to keep in mind that, people don't understand what's going on with them when they're having a stroke, especially if it's in an area that can affect your cognitive ability. People aren't usually going to come out and say to you, hey, I'm having a stroke. You have to be able to see what the signs are. And if you're ever wondering or you're not sure, it's better to err on the side of caution. Don't dismiss any symptom, and don't just, if it's you or a family member, don't wait for it to go away. You should, call 911. So one of the common mnemonics that we use is the FAST mnemonic. So, it stands for face drooping, that's the F, and that's one of the common signs that people know of. Arm weakness, so that's the A. S is for speech, and T is for time to call 911 immediately. So they're not the only symptoms, but they're just 3 good ones to remember, and this is an easy way to remember it. And you can have, sudden weakness. You could also have numbness and tingling, and it's not just arm, it could be face, arm, or leg. And, usually it's on one side of the body. Sometimes people describe it as a heaviness sensation. You can also have confusion, trouble speaking, all kinds of speech problems, slurred speech, difficulty understanding speech. People might just seem like they're confused, but it's actually because they're not understanding the language anymore. You can have balance problems, difficulty walking. You can have dizziness. You can feel like the room is spinning. We call that vertigo. And you could have vision problems, problems seeing out of one eye, problems seeing out of both eyes, severe headaches, out of nowhere, one of the worst headaches a person ever had. And back to the fast mnemonic, it's an easy one to remember, easy to teach. So this is something that, the stroke, community of providers, we always try to promote. So if there's anything you remember from this lecture, remember this fast mnemonic. So FACE for the F, A for arm weakness, S for speech problems, and T for time to call 911. So I won't go into more on that, but basically everything I just explained. You might see another mnemonic called B fast, and that's just to include more of the symptoms. So eyes with the vision problem, B for the balance, dizziness, or headache. So what do you do when someone is having a stroke or you suspect someone is having a stroke? One of the common sayings that we have in the stroke world is time is brain. And what that means is every second counts. So you need to call, 911 or bring, your family member to the hospital immediately. So, they've done a study before and they found that nearly 2 million brain cells die each minute during a stroke. So every single second counts. And there's also certain treatments that we have now, and I'll get into that in a minute, but there's certain treatments that are available and can even, to the point of completely reverse a stroke, that these are only available in a certain time window. And if it's beyond that time window, then, you might not be able to get that treatment. So those two treatments, one's a medication, and that's called TPA. And the second one is a procedure, and that's called, the big term for it is endovascular neurointervention. So first we'll talk about the TPA. So the TPA, it stands for tissue plasminogen activator, also called alteplase. Essentially, it's a blood clot buster. It dissolves the blood clot. It, thins your blood out very quick, very fast, and it helps, just dissolve the clot, open that blood vessel back up, and get the blood going to where it needs to go. It works better, the sooner it's given, and the time frame for that is 4.5 hours. So you have to get to the hospital quickly. And not everyone can get it. There's, a doctor in the emergency room and, usually collaborating with a neurologist, and they determine, which patient is a candidate to receive that drug. And there's a lot of different factors that go into that I won't get into. The other treatment is this endovascular neurointervention. It's also called a thrombectomy. This is the newer of the two treatments, but has been improved upon every year for the past maybe 2 decades that we've been doing it. And it's similar to what they've done for heart attacks for years. Some people might know the term of cardiac cath. So they can actually go in, they go in usually the femoral artery with a catheter, and then they can, remove the blood clot or open the blood vessel back up. So this is a similar process that's done in the brain. And, this involves the physical removal of the blood clot. And there's different types of devices and ways that they do that. And one of those is that they can use this thing called an aspirator, and it literally sucks the blood clot out, almost like a vacuum. And the other way is with this device in the picture. This is called a stent retriever, and it's a way to kind of grab onto the clot and yank it out. So an important part of this whole topic is not just the treatment of stroke, but it's preventing the strokes from happening in the first place. So we'll go into the risk factors, and there's certain risk factors that you can't change, unfortunately. So that's family history of stroke, older age, your race, whether you're Black or Hispanic, your gender. Like I said earlier, women have more strokes than men. And, they can put you at a higher risk and you can't change them. So, there's no use, really even thinking about it that much. The ones that you want to focus on are the risk factors that you can control. And that's the best way to prevent a stroke, is to control all those risk factors. So those risk factors are high blood pressure, and you want to, get your blood pressure checked frequently. If you have high blood pressure, even consider, checking it at home. Work with your primary doctor or whatever doctor is, helping you manage your blood pressure. And above 130/80 is what we consider high blood pressure. Diabetes is another big risk factor. And if it's uncontrolled, that high blood sugar can increase the amount of plaque in your arteries. High cholesterol also does a similar process, increasing that amount of plaque. And other important things, if you're on medications for these conditions, don't forget to take them. If you smoke, quit smoking. And also cocaine use is, one of the big drugs that we see can cause strokes to happen. So avoid that at all costs. And if, there's medications also that can help with stroke prevention. And that the two big ones are aspirin and statin medications. Those include Lipitor, for example, or Crestor. I won't go into its complex of, which patients should or should not, but it's something that you should bring up with your doctor, is, asking if, taking an aspirin or a statin or both is the right thing for you. Of course, healthier eating, losing weight, regular exercise. I'll say a little bit more about this one. That this is the atrial fibrillation, that irregular heartbeat. So heart palpitations, you're feeling like your heart's racing or feeling like your heart is beating funny. If you ever feel that, don't ever ignore that. There's always a chance that could be this condition. So, you should ask your primary doctor or your cardiologist or neurologist, if you already have one, about atrial fibrillation, this irregular heartbeat. Always bring that up with your doctor. Sometimes, oftentimes we find out someone has this condition when it's caused them to have a stroke, and then they're hospitalized, and then we find this. So, you want to find this condition before you have the stroke. If you have this condition, it increases your risk 5-fold of having a stroke. And there's devices that can help find this condition, that are new technology, that they've been around for maybe the past 10 years or so, and they're turning out to be really, really useful. And what they do, it's a little tiny computer chip. It goes right under your skin of your heart, and it basically always keeps a watch and is always recording your heart rate. And then that information is sent wirelessly to your cardiologist's office, and then it's monitored. And this condition, if you have, then you go on a stronger blood thinner. You see commercials for this all the time on TV for those blood thinners. Lifestyle risk factors, like I said, smoking, current smokers have a 2 to 4 times increased risk of stroke compared to non-smokers. And alcohol use, heavy drinking can increase your risk for stroke. So no more than 2 drinks per day for men, and no more than 1 drink per day for women. Or just cut out drinking completely would be the healthiest way to go. And activity, they say 15 to 30 minutes of activity a day. And so the good thing, to do is get in a regular exercise pattern if you can. Maintain a healthy weight. And, the obvious stuff, eating healthy. A lot of times patients ask me which diet is the best. Well, the one diet that has, the most evidence of reducing cardiovascular disease is called the Mediterranean diet. So in the same way, that would be the diet you should aim for preventing stroke and cerebrovascular disease. And, I included the classic food pyramid here. It's pretty much everything you would think of is a healthy diet. You know, avoid fried food and, you know, too much, you know, beef, and you know, eat more fish and vegetables and stuff like that. So that's the end of the lecture.
Great. Actually, I do have some questions that we wanted to go ahead and see if we can ask you. One of the things is in regards to the, you were speaking of the device that they put, I guess, under the skin to kind of track the heart. Is that similar, or does that work with a pacemaker in any ways, or is it just totally different?
A pacemaker is very similar to that device. A pacemaker does that already. Usually it does that capability. It's all a pacemaker. It paces the heart when you have a rhythm problem. So they put a pacemaker in to restore that normal rhythm, and it controls the rhythm, but it also is recording the rhythm. So, you know, the extra activity that the heart's still doing, the pacemaker is recording. So cardiologists can always go to the pacemaker and say, okay, what has been going on with the heart in this pacemaker? So basically the pacemaker controls and records, controls the heart rate and records the heart rate, I'll say. The loop recorder is just recording. It doesn't do anything, it just records. It's more of a diagnostic utility. And the pacemaker is, you know, it's, you know, you wouldn't put in a pacemaker until you found the rhythm problem. And the pacemaker is a much more complicated thing to put in because it has these leads, these wires that then have to attach to certain parts of the heart, and it's really deep in the body, it's bigger. The loop recorder is just a tiny little chip, and they have this device, it inserts it, you know, makes a little incision all in one little process. The person doing the procedure just goes like this, holds it to your skin and goes, and it's done. And sometimes they don't even need a stitch. They just put a little piece of, you know, steri tape, or they might do 1 or 2 stitches, and then, you know, there's a little bump there where it is, you know, it's about the size of a quarter, but, you know, you don't really notice it other than that. And we've noticed that it's been helping catch a lot more atrial fibrillation, you know, this in the recent, you know, decade than we were doing before, because people, this irregular heartbeat can come and go. So that's an important thing to know. There's a version of it called paroxysmal atrial fibrillation, which just means it happens once in a while, and it can happen for just a minute and then not happen again for 6 months. So those cases were being missed because people used to wear something called a Holter, and a lot of people have heard of a Holter monitor, and it's something that you wear. It has a thing that on your hip, and you have these leads, and the longest people would really record for those is maybe a couple of weeks. And it was a, you know, a pain in the butt to wear. It would get wet. You have to take it off for the shower. Sometimes the leads would come off. It doesn't work right. And they did this study where they invented this new technology, and it just constantly goes in once, it constantly records. There's no issues. You never have to think about it again. And they were finding a lot of this irregular heartbeat, this AFib, 3 months, 6 months, even up to a year down the road that they would never have seen before.
Kind of in that same factor then, what do you think of smartwatches, like an Apple Watch or Fitbit or something to that nature?
Oh, I think those are great. I just got an Apple Watch actually last week, my first one. So, and yeah, it measures. I have to look into it more, but they have the capability of measuring your heart rate and, you know, doing a similar function. And I know I think there's, you know, a lot of cardiologists and the EP cardiologists, which are the rhythm, the wire, you know, the ones that deal with the wires and electricity of the heart. They are starting to, you know, work more with that technology. I think it's a very great thing for medicine.
Another question I had is in regards to women and strokes. Do either menopause or on the other spectrum, pregnancy, have a higher risk factor for strokes, as some women sometimes develop high blood pressure either during their pregnancy or sometimes during menopause? Are those factors that women should have to look out for?
Yes. You know, I don't want to scare women and say that menopause directly has a strong influence on stroke risk, because it doesn't. But it's you know, I'd say pregnancy is a little bit more concerning than menopause is. And what it really is you mentioned the blood pressure and the hormones. It's the hormones and the blood pressure are the big things, not, you know, the pregnancy itself or the menopause. The menopause is, you know, it's the changing of the hormones, but it's the hormones themselves that can sometimes cause what we call a hypercoagulable state. So your blood is basically, what that means is, with certain changes in your hormones, your blood can be a little bit thicker. There's a slightly higher chance of forming blood clots. And that's why, you know, hormonal birth control, some women may know that has a slight increased risk of developing blood clots. You know, I think that's what the doctors who prescribe that to patients, they always warn you of that. And that's because it's raising certain hormone levels more than it should. The blood pressure itself, blood pressure, when it's really high, can increase the risk of the more deadly hemorrhagic stroke, the one where the blood vessel pops and bleeds. Over time, blood pressure, so if you have blood pressure that is started or associated with menopause or after menopause, then that can increase the damage over time to the arteries. It increases that cerebrovascular disease. It can increase the development of that plaque. And basically how high blood pressure does that is, you have higher pressure fluid going in a pipe. It has more turbulence, that fluid, more pressure, more turbulence, and it's just over time doing more damage to the wall. And when the wall's damaged, then these cholesterol plaques develop and they build up on the wall. And one of the ways I like to describe it to patients so that they can understand it better is, think of everything in this stroke world that I've been describing as a system of pipes, like in a house, of iron or steel pipes. And over time, rust builds up in the pipes. And if you have, over the years, a piping system in a house, there's going to be small pipes and medium and large pipes from the street where the water's coming in. And over time, if you let something rust for hundreds of years, which pipes are going to, rust and break and get blocked first? It's not the big one in the street. It's the smallest ones at the little end, at the faucet level, where you turn on the water. And that's, that's the way to think about this whole process of plaque and cerebrovascular or cardiovascular disease. And like the high blood pressure, the high cholesterol, the diabetes, all those risk factors, age, they all increase the amount of rust that's forming. Now, the age, the gender, the race, you can't change those, but you basically are, and the eating you can, diet, but you want to basically get control of all those risk factors and slow down the rust formation as much as you can.
That's a great analogy, and that makes total sense now, picturing that in my head. One last and final question, just as we are still in the pandemic, how has COVID, has that had any kind of effect in people who've had COVID? Has that had any kind of effect for stroke cases that you guys have noticed?
Big, yeah, and we're seeing it more and more. It's still, a new virus that we don't completely understand, but we have seen that compared to other viruses, compared to the normal flu or any kind of virus, this one especially has a very, very high chance of causing strokes. We don't know exactly why, but it's definitely something that we're seeing. And, my guess is that it's causing such profound and rapid, in some people, inflammation. The body just reacts to this virus. The immune system gets so revved up. And when that happens, the immune system gets revved up and it releases all these different chemicals. There's so many different changes that are causing this widespread inflammation. And when you have inflammation, that's always been associated with that hypercoagulable state. So the thickening of the blood gets a little bit thicker, it has a little bit higher chance of forming blood clots with any amount of inflammation. And because that inflammation is so fast and so rapid with COVID, we're seeing more blood clots forming. We also see both types of strokes we've seen, but it's usually with the blood clot, the ischemic one, that we see. But yeah, we've been treating a lot of those here at Memorial.
And has age had any kind of effect at all with that, or is it just, it's really kind of across the board for anybody?
It seems like it's followed the general age distribution of things. More of them are in the older individuals, but there have been cases of younger people having strokes because of COVID. So it's one other reason why there's a rare conditions that cause younger people to have strokes, and it definitely is a big one going on right now. The distribution's about what I think you would expect, but it's because it's so prevalent. It's right now it's one of the big causes of strokes in young people.
Thank you for watching this webinar. Please follow the instructions on the screen to earn NAHUC contact hours. You may visit our website, look for education, click on virtual library to access the post-test and instructions. Please call or text or email with any questions that you may have. Our contact information is listed on this slide.